Welcome back, everybody, to the show here today. We're all health and wellness today. Everything is great. We've had a nice workout from Pat Fleming. We've had healthy fish with Chef Kenton in the kitchen. We're going to learn how to incentive to quit smoking in the next segment. But right now, we are going to learn from head to toe how we can be well with Dr. Nathalie Beauchamp from Beauchamp Chiropractic. It's good to see you, Dr.
Hello,
Nathalie.
you guys. You're having way too much fun.
I know, we have a lot of fun.
We hear that from a lot of people. But it's a great job. What are you going to do, right?
We have such a laugh.
And don't be scared. I cannot see right through you completely.
Okay.
So you're safe.
So
You
you're
still
not
have
like
some
the new
secret now.
security at the airports.
No,
okay, I feel a little bit better.
Well, this is great, though, Dr. Nathalie, because we've had you on the show before, and we've learned little bits and pieces from you of what chiropractic can do. So we wanted to expand on this, because I think that people out there don't necessarily know that you can actually fix your health from head to toe by using chiropractic. Is that correct?
Very much so, and that's a very good point. People will wait to have pain before they consult a chiropractor. I always say to people, like, why is it that you wait until you're 50 years old to go to a chiropractor? We have our teeth checked, we have our eyes checked. Why is it that it's 50 years old is the average age when people come into the office?
Point.
So our whole theme today is really to educate people of the power of the nervous system.
Okay.
And that's what we're going to talk about. And I've brought some cool tools, and I know you like technology. So
I love it. Well, and that's what we want to talk about, too, is what to expect when you visit a chiropractor. So I come into your offices. What do I expect?
Well, the first thing we do is we do a very detailed health history. You know, slips, falls, car accident, like things in the past that people don't always think that will have an impact. And it's funny because people will forget they fell off the roof when they were 10 years old, or they forgot their 3-car accident in a row. And
you
like,
did fall off the roof.
That explains.
I just might explains a lot. Not only did it affect my back, but the brain.
But you see my point that, I wasn't sore, I didn't break anything, so we don't correlate, this with some of the issue we have. And also, it's not just physical stress. It is psychological stress and nutritional stress. And that's how I explain it to my patient, that the stress is not just in one dimension, but in the 3 dimension. And people will say, how can, eating bad can affect my spine? Well, I'll explain that with the nervous system with what I have, and you'll see how important it is. So, health questionnaire when you first come in, and then one of my assistants will go more in detail, because we have to fish for those slips and falls and those things if people are on medication and all that. And then I go in, ask a few more questions if need be, and then we look at the posture. And I know you guys were talking about your posture. So
I know what you're talking about.
So what I might suggest, is it okay to push the chairs a little bit so you guys can look at each other's posture? Okay, so let's push your chairs, and you're going to do it on each other. So we're going to start with TL standing. Actually, face this way a little bit if you can.
Okay.
All right, so what I want you to do is go in front of her.
Okay. Facing?
Yeah, not that close. You don't have to be this close.
Well, we sit uncomfortably close every day.
Yeah, that's all right. And what we're going to ask TL to do is close her eyes and shake your head a little bit, and then stay put. Okay, now come over here. You'll see it more. Now, do you see that her right shoulder is lower?
Yes.
Okay. Do you see that her her head is tilting to the right?
Yeah.
Okay.
It is?
Do you see that her hips are fairly level, but this arm is more forward than this arm? So there's rotation in her pelvis. Now, Tia, if you don't mind going to the side.
I'm a mess.
Actually, not too bad compared to what I can see in the office, I can tell you.
Wait till I do it.
Here, what we're looking for, again, is having a good posture and the neck not being forward. So it's the middle of the ear, the tip of the shoulder, the center of the hip, and then the malleolus, the ankle bone. So her posture is actually quite good. You must get adjusted, right?
I do. She does. No, but it's funny because you kind of caught me off guard, because if you had have said you were going to do that to me, I would have been all...
Yeah, but do you see how we close it? We ask people to close their eyes, and what happens is we lose the visual input, if you want. So it really is, like I have patients that go forward almost losing their balance, and then you can really see the shift. Why don't we check your posture?
You want me to go on this side? Here,
that'd be helpful, thanks.
Okay, so I'm just going to close my eyes,
loosen
shake my
up.
head.
Oh boy. Sorry, I see it very fast.
Like, give me a minute. I haven't even finished shaking the head.
Shake your head. Close your eyes.
Okay, what do you see?
Okay, I see this shoulder is lower. The right shoulder is lower.
Much lower, yes.
I see his head is tilted to the left.
Yes.
I see he doesn't have
You're
hips,
good.
so I don't know.
Well, you can see by the length of his arm. You see this,
Oh, this-
right
yeah,
arm
it
is
is.
longer, so that means he's going this way. And his torso is shifting to the right, so that
Okay,
way.
can you turn around, my friend?
Okay, sideways?
Yeah, okay. Now,
So-
you said his
I disappeared.
Yeah,
his ear is not over his shoulder.
it should be the middle of the shoulder.
Oh,
so
you're a
his
little
neck,
far ahead, bud.
yeah, his neck tends to be a little
You're a
bit
mess.
further.
You might as well.
So that being said,
Wow, that's great.
that being
good,
said,
good.
your left shoulder is lower. So what do you think it might do to your spine?
Probably bend it.
Exactly. So it shifts. So posture, we say, is the window to the spine. So
I
that's
never,
very important.
I never noticed any of that stuff on you.
Right? Well, that's good.
You're going to look at him in a different way,
We're
right?
gonna look at
that's
everybody
something.
now. in a
Everybody
different
at
way.
home right now.
Oh my goodness! Look
Every-
at Doug, our floor director.
Everyone at home is standing and shaking their head and doing
They're in
that
the
right
mirror
now.
right
Yes.
now. Oh, geez.
And I'll even say that too. And at the clinic, we have 2 scales as well, so we can see. And some people have like 30 pounds different from left to right.
Really?
I mean, depending
Wow.
on how much you weigh, you know, it's a huge difference. So you can see how it's shifted and so forth. So that's what we do. And then after that, I will touch the person's spine to see. And with my hands, I can really see what is out of alignment.
Okay.
But also, we have technology in the office that is certified by the Space Foundation, and it's used at NASA with the astronaut, was used on 2 shuttlecraft missions to measure the autonomic nervous system of the astronaut when they go to space, because we wanted to see what kind of impact it had. So I have 5 technology that I use. So I'll just explain briefly, and then we can see at one of the scans.
Okay.
We look at range of motion, which is very important, because if you have lack of motion, the signal to your brain by the nerve is not going to happen properly. And a friend of mine uses this great analogy. It's not just the bone being out of alignment, it's the lack or decrease in movement. And your brain signal won't be sent properly. So let's say your pancreas would hear blah, 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 as opposed to be a good pancreas and secrete insulin and glucagon. So just being out of alignment is not always the case, but the restriction in movement. Then we have something to measure the pain sensitivity.
Okay.
Then we have 2 scans. One scan is called a thermal scan that measure how your autonomic nervous system works. That's what I have on the computer.
Right.
Then there's a muscle scan that looks at normal or abnormal muscle imbalances. So if you have muscles that are pulling one side to the other, you know, it's going to create some shift.
Dr. Nathalie, you've brought,
Yes.
you've brought some of these that
Yes.
you're going to show us scan,
Yes.
right? What
Yeah.
we're going to do is we're going to take a quick break.
Okay.
And then this is so interesting. We're
I
going
love
to
it.
we're going to take a quick break. We're going to come back and have you show us actually what the scan results
Perfect.
look like. Is that good?
Perfect.
Okay.
All right.
So don't go anywhere. Dr. Nathalie is going to take us through the scan, and we're going to sit very straight. And everyone, do this at home while we're on a break.